Hi, it's Stephanie Patton, your Stoughton Prevention Coordinator, and I'm back to talk to you about alcohol and other drugs and the findings from the 2026 Youth Health Survey. So, here are a few highlights from our data. So, one of the things that's really exciting is that substance use continues to trend down in Stoughton. One of the ways we measure this is we ask students on our surveys, have you ever used alcohol, electronic cigarettes or nicotine, marijuana, and some other drugs. And so here you see the summary findings since 2017 of what's been going on trend-wise with alcohol, e-cigarettes, and marijuana at the high school. And you can really see that our use rates have been going down since 2019, which is fantastic news. And they've been going down in pretty significant ways. So most students in 2026 at Stoughton High are choosing not to drink or to use electronic cigarettes or marijuana. And we want to continue to foster those healthy trends. We also measure the similar trend at the middle school. Here you just simply see eighth grade data. The good news is that sixth graders who are included in our surveys, their numbers of have you ever used substances really are around zero, which is what we like to see. And it does also impact averages when we look at numbers. And so we often will run this data chart, which looks at eighth graders, which also gives us a snapshot of who's transitioning into high school next year. And so here you see the current have you ever used rates of alcohol, electronic cigarettes, and marijuana. And again, those rates are low. This is an area, particularly with eighth graders, where we really do think about hope and concern. Most students have never experimented with any of these substances, and some have. And some have at a pretty young age, and that's concerning and something that we do need to be paying attention to. We also ask students where they access substances, and this is data from our high school students. So again, in the context of most students do not do these things, we do need to be paying attention when students are choosing to use alcohol, marijuana, electronic cigarettes, other substances. And we know that from our student data, the most popular sources for alcohol are at home with their parents' knowledge. And so, just as a prevention caveat here, it's really important to understand that the age of first use, when students are first exposed to using alcohol or other substances, really does have a long-term impact in terms of increasing risk for future challenges with substances. Not a guarantee, but the research does tell us that that is an important, um, potentially controllable risk factor, and that the further off we push that age of first use, the less risk that can come from it. So, important information to consider. Popular sources for marijuana and electronic cigarettes tend to be more social, underage friend, or followed by somebody who's of age for marijuana. E-cigarettes, somebody else purchased them or they borrowed them. In all of these cases, the good news is that we aren't really seeing students purchasing underage. Our vendors are doing an incredible job with that. And we are seeing sort of diverted, legally purchased products that are ending up in the hands of young people. We also look at 30-day use. And so this is the snapshot of how we measure what's current use, to get a picture of sort of who uses a little bit more frequently or regularly. And so that's an important number that we look at. And you can again see here in this chart at Stoughton High, those numbers are all trending down. You do see that peak with electronic cigarettes in 2019, which is when we really were in the midst of the Juul and vaping situation. A lot of work has been done collectively in our community and across the Commonwealth to address that issue. And so you can really see that those prevention efforts had a big impact there. We also take a look at the when students do use substances. And so this chart is really only about the students who use at the high school to try to get a snapshot of how they're using. And so you can see what's sort of interesting, most interesting about this chart is particularly among students who vape and who use marijuana. We have a lot of students who are using at the high end, 10 or more days a month, which is concerning, right? So, although use rates are trending down, the way students use is continuing to be a concern. Students who use tend to use more frequently. With marijuana and vaping as well, a lot of these products are really high potency and kind of pack a pretty big punch differently than maybe what they used to look like. And so that's also important to another area of concern when we think about what students are using when they use. Again, just to caveat this, the reason you don't see zero use in here is because this chart is only about students who are using substances. And you saw before, those numbers are not big numbers, but again, something we really want to be paying attention to. And lastly, this is something that's very near and dear to my heart. We really want to be paying attention to perceptions of use. So some of you might be sitting at home thinking, wow, those use rate numbers, I don't know. I don't know if I believe them. They seem really low. This chart is showing non-use, which is why we see those really tall bars. That's what we want to see here. And they're also showing the perceptions of non-use. So for example, while most students have never vaped, we see 90% in those last columns. Only 33% of students would be able to correctly report that the norm is non-vaping. So what we want to try to do is close the gap between what students think that their peers are doing and what they're actually doing. And so if you're having a hard time wrapping your head around some of these really positive findings, know that you're not alone. Our students are struggling with that too. And it's really, really important that we work to correct those perceptions because when students perceive that most of their peers are using alcohol, marijuana, vaping, or doing other behaviors, they are more inclined and are at higher risk to do those behaviors themselves. And so correcting for that healthy, positive norm is really, really important. So just to recap here on this slide, at the high school, what you can see is 90% of our high school students have never vaped, 92% have never used marijuana, and 75% have never used alcohol. And those are great numbers, and we want to keep up those good trends.